everyone. So it's Friday the March 13th and I am doing huddle today. And I am doing huddle because I want to spend the time talking about COVID-19 and how that relates to all of us here at work. And so first and foremost, please know that being in a food service position within the hospital, you have very limited risk of coming in contact through work COVID-19. So I think that's probably the first thing to be aware of and be cognizant of. The other thing is all basic information as it relates to what we should be doing anyways, regardless of COVID-19. It is influenza season still, and so regardless of what's going on or what is out there, we want to be healthy. And so the same way that protects our health all the time is applicable during this COVID-19 infection that's going around. So important things that we have posted for your information. We have the nice guideline that SSM has put out for employees to show if you're showing symptoms and they are symptomatic to flu, this is what you can expect. If it is symptomatic to COVID-19, this is what to expect. There is an algorithm also that they put out if staff are experiencing illness and they call their supervisor because they feel ill that day. There is an algorithm out there that your leader is going to go over with you. The risk for COVID-19 is still really related to travel or you being around somebody who has traveled and has tested positively for COVID-19. So again, the risk is low. Another thing for your information was a nice release that Laura Kaiser had put out to employees to let them know, again, some of the facts that are related to COVID-19 and important need to knows. And then all the things that we want you to be cognizant of all the time, again, regardless of COVID-19, but especially now because we want to limit your risk of getting sick, of anything. And these are things that are going to help protect your health all the time. So cell phones, they are not allowed anyways on your person while you are tasking. They are a huge source of bacteria, so to be going between your cell phone and working is not appropriate to be doing anyways, but we certainly are going to be watching that more now so we can limit that risk. You want to make sure that you're washing hands. Washing hands always has been, still is, and always will be your best friend of staying healthy, so you want to wash your hands. You want to change your gloves. I have seen associates with gloves on and eating with gloves or going from one task to another with their gloves on and not changing them and washing their hands. Gloves are not the end-all say-all to protecting you from germs. It will protect you in the moment, but you still need to change them as you're touching surfaces and going from one thing to another. So you need to change your gloves, you need to wash your hands, and then put new gloves on. We are right now, as an extra precaution, we have the plastic aprons in the dish room, just to protect your clothing. You should always be wearing gloves when you're stripping dirty trays anyway, so again, that's nothing new. And there is a nice resource on the intranet right now, on the SSM intranet, for all COVID-19 topics to kind of set the record straight, to let you know truly what is out there in the public, what you should know, based on scientific-based, reliable resources. The end-all say-all to the resource that you should be checking for accurate information is the CDC. Everything that SSM is doing currently is based on the CDC recommendations and guidelines, and we continue to follow that CDC recommendation. If we get any new information, we're going to post it on the huddle board, so please make sure that you're checking that. Again, That's all I'm covering for the huddle topic because it's an important one. If you have any questions, reach out to your supervisor or reach out to myself. I would rather you call and ask the question and set your mind at ease than to feed into any false narrative or to share any inaccurate information. Just come and ask. If I don't have the information, I will find the information for you. Okay, have a good Friday the 13th and a nice weekend. Bye guys.